My name is Vic Ross. I'm a dermatologist at Scripps Clinic in laser and cosmetic dermatology. Yeah, so I became interested in Sylfirm X when I was approached by one of my colleagues who said it was a very nice device, and I was intrigued by the fact that I'd used other radiofrequency microneedling devices, but they were fairly painful, and they were insulated needles. So this was an opportunity to look at non-insulated needles with less heating and see if we could get just as good results in a very kind of safe fashion and effective fashion. Yeah, so when we use Sylfirm X, we're using it for two basic things, but one particular case that stands out is we had a patient with refractory melasma. We had been trying different topical regimens, different sort of energy-based devices, and really weren't getting a good response. We added the Sylfirm X with very low settings, 300 micron depth, and power level of 2 or 3, and multiple passes with no numbing. And she still did pretty well, and it certainly seemed to enhance the response to the other agents for the melasma. So our patients have responded well to Sylfirm X. The advantage of it is that the pain has been modest, not severe. We're able to use the Sylfirm X for a variety of conditions, and I think the main thing we use it for is neck improvement and lower face improvement. So most of the microneedling I do with radiofrequency is confined to the lower cheek and the neck, and that's where really 80% of people have issues after age 40. So regarding complications with Sylfirm X, to be honest, we really haven't seen complications. We had one patient with melasma whose melasma got worse, but it was the spring, so I think it got worse because it was springtime in San Diego. Occasionally we'll see little dots that will last maybe for 5 weeks or 4 weeks, but we haven't had any sort of durable side effect. It's been pretty side effect free, not bruising, no real other issues. Yeah, so the ideal candidate for Sylfirm X is somebody who we've already done a reasonable job of reducing maybe pigment and making the skin fresher on the surface. The Sylfirm X acts by tightening that skin below the surface. So the ideal patient is someone who has skin that's okay on the surface, but now we're trying to get some tightening and some firming of the skin, particularly again along the jawline, the jowls, and the neck. That's really where I think the device stands out. So adding Sylfirm X to your practice is ideal if you want to add a skin tightening device that is able to safely and somewhat painlessly achieve some skin tightening on the lower face and neck. So if you have a kind of a hole there in your practice where you don't have a reliable skin tightening device for tone and texture, this would be an ideal addition to your weaponry as far as your energy-based devices. So I think the future of Sylfirm X is bright. The number of needles and the depth of the needles and the reliability of the device, I think, paint a bright picture for it. So I think it will never be able to do some things. It's not going to remove pigment like a pigment laser. It's not supposed to do that. It's not going to resurface the skin, but it's going to allow you to do some tightening in a very reproducible, reliable way with modest temporary side effects and really, in our practice, no long-term side effects. I think the one thing I'd like to share is I think the quietness of the motor and the elegance of the graphical user interface make it just more enjoyable to use. So it's a nice device to use from a standpoint of ease of operation from the physician. Taking the tips off, putting them on, very easy. So I think a lot of thought went into making the device easy for the patient and the practitioner.